If you are leaking protein in the urine, irrespective of what your eGFR is, your eGFR could be 90, it tells you that there's kidney damage because you should not be leaking protein in the urine. If there's protein in the urine, then that's a direct consequence of the kidneys being damaged. You can have kidney stones and still have normal kidney function. But when the stones increase in size, that can cause obstruction or blockages. People can develop kidney stones by following a relatively healthier diet. You form them when you follow a diet high in oxalate, which is found in healthy food like spinach, green leaves, raspberries, dark chocolate, nuts. In general, I think that you should always be mindful during your annual physical of your creatinine levels, especially in your eGFR. Always ask your physician if there was anything abnormal in your urine analysis, if there's any protein in the dipstick.
The last episode, we covered what your kidneys actually do, the whole behind the scenes operation most of us never really think about. But today we're going one step further because at some point, most of us will get a lab result with words like eGFR or creatine and have absolutely no idea what we're really looking at. I know myself is included in that. Dr. Gotti is back to really decode those numbers. And we're also getting into kidney stones because I know that's a question that comes up constantly for Dr. Gotti. So welcome back. It's nice to see you as always. How are you doing today before we hop into the show?
Doing great. Thank you for asking. How are you?
Good. Everything's good. I'm happy to be back and get the chance to connect with you. And we talked a little bit about how a lot of people are not super familiar with what kidneys really do, but everyone kind of knows or has heard of kidney stones. So I think it's really important that we're talking about this conversation.
Yeah, no, absolutely. People do get lost in some of the names also that are associated with kidney function, like creatinine and GFR. So I know we'll get into that.
All right. So yeah, let's start off with that. So let's start with one people see most often and kind of understand the least. So creatine. And what is it and why does it show up on every kidney panel?
So creatinine is a waste product from muscle breakdown, and your kidneys filter out creatinine. So it's the best way to gauge an estimate of your kidney function. So a normal creatinine level for women is up to 1.2, 0.6, 0.8 to 1.2 for men up to 1.3, but that can fluctuate based on patient's muscle mass. If you have a higher muscle mass, so people who lift weights, who go to the gym frequently, who bodybuild, will have a higher creatinine level at baseline, but that doesn't necessarily mean they have kidney disease. It just means they have a greater muscle mass, and creatinine is a waste product of muscle breakdown. But because your kidneys filter it out, it also gives us an estimate of your kidney function. When the kidneys take a hit and there's an injury, if you're dehydrated or if there's an obstruction of flow of the kidney, obstruction of urine, the creatinine will go up. And that tells us there's an acute kidney injury. Or if the creatinine is consistently high for over 3 months, that's another diagnostic criteria for diagnosing somebody for chronic kidney disease.
Got it. So if creatinine has some limitations, that's where eGFR comes in. Is that correct? Can you kind of explain what it is and what the number actually means?
Right. So creatinine will tell you what your normal kidney function at baseline is, and if you have an acute injury or if you're progressing toward chronic disease. eGFR stands for estimated glomerular filtration rate, which basically tells you what the filtration capacity of your kidney is. So what the overall function of your kidney is. When you're born with 100% kidney function. That's normal kidney function. When there is a kidney injury or eventually kidney disease, the function of the kidney declines. Your creatinine will rise and the eGFR will decrease. So I said 100 is normal. Over 90 is still fairly normal, but sometimes when you have an eGFR over 90, you can still leak protein in the urine, and that could be a clue there's some kidney damage. But once you see an eGFR of 60 to 89, those are early signs of mild loss of kidney function. And then once the eGFR is below 60, that's when we start staging patients with chronic kidney disease. So if you have an eGFR of 30 to 45, that's stage 3B. 45 to 60 is stage 3A. 15 to 30 of your eGFR, meaning a patient has a kidney function of 15 to 30%, means you're in CKD stage 4. And below 15% is stage 5, and that's when you're nearing dialysis. So it allows us to estimate where someone's kidney function and percentage is and stage their kidney disease as the function declines.
Got it. So, can you kind of walk us through what someone should actually do if they, let's say, open their lab results and they see a low eGFR? What would
Mhm.
be the first step for them?
Tricky question. So the first thing I would say is to not panic. And again, the context does matter because, first of all, in an acute scenario, a change in eGFR is irrelevant. We typically only assess a change in eGFR in a chronic scenario, and you also want to look at the creatinine. And like I said, what was the insult? Was a patient dehydrated? Was there vomiting? Was there diarrhea? And you can talk to your primary care physician. What was a baseline creatinine, not the eGFR? And what's the creatinine now? And is there a kidney injury happening that you're unfamiliar with?
And then, to my knowledge, there's a third number, right?
Yeah.
So,
Mhm.
ACR. So, that most people kind of haven't heard of at all. I know I hadn't heard of it prior to this. So, can you explain what it is and why you say it actually might be more important?
Yeah. So ACR stands for albumin to creatinine ratio. There's also PCR, protein to creatinine ratio. We're basically measuring protein leakage into the urine. And it is slightly, I think, more of a sensitive marker to diagnose kidney disease because if you are leaking protein in the urine, irrespective of what your eGFR is, your eGFR could be 90, like I said before, but you could have diabetes for over 10 years and leak protein in the urine that tells you that there's kidney damage because you should not be leaking protein in the urine. If there's protein in the urine, then that's a direct consequence of the kidneys being damaged. So healthy kidneys will keep protein in the blood, damaged ones will spill it out into the urine.
Got it. Okay, that's a good way to kind of think about it and wrap your head around it for
Yeah.
someone who's not like well versed in this at all. So, let's say if someone has never really had an ACR test, because it sounds like it's something that's not automatically tested for, super common. What should they do?
It's very simple. You basically just you ask for a urine sample, which is low cost, low effort, but high value in identifying if there's any kidney damage. You ask for urine analysis, and your primary care physician can look at the urine dipstick to see if there's protein. And if there is protein in the urine dipstick, then you can check a urine albumin creatinine ratio or protein creatinine ratio to look for protein leakage in the urine. It's
And
especially important if you have diabetes, hypertension, family history of diabetes, or kidney disease.
and then these were kind of the more intricate things I would say, but let's kind of shift into what most people know about or hear about, or like what you said comes up super frequently for you, kidney
Yeah.
stone. I know a
Yes.
lot of people kind of wonder, if my kidneys are filtering, does it have stones? What does that mean? Is something wrong with my kidney function? So can you kind of like speak to that a little bit?
Right. So having kidney stones doesn't always mean you have kidney disease. You can have kidney stones and still have normal kidney function. But when the stones increase in size, that can cause obstruction or blockages, which can damage kidneys over time, leading to kidney disease. So, kidney stone does not mean kidney disease, but kidney stones are a completely separate pathology in its own. And they're interesting because people can develop kidney stones by following a relatively healthier diet. If you have a calcium oxalate stones are the most common type of kidney stones. And you form them when you follow a diet high in oxalate, which is found in healthy food like spinach, green leaves, raspberries, dark chocolate, nuts, a lot of tofu, things like that. So I've had patients who come in following that specific diet and all of a sudden they develop kidney stones. So that's why it becomes a little bit more it's an interesting disease concept to understand because you think you're following a healthy diet and all of a sudden you have a kidney stone, but it teaches you, I guess, the importance of moderation and balance in diet.
Absolutely. So how do like kidney storms actually form? What's happening in the inside the body? How does one really get kidney stones?
Right. So, like I mentioned, there's different types of kidney stones. Calcium oxalate, calcium phosphate are two of the more common, oxalate especially, and you can form it with diet alone. And then if you have frequent urinary tract infections, you can also form a specific kind of kidney stone from the bacteria in the urinary tract infections that saturate and lead to kidney stone formation. And then there's also genetic consequences, genetic factors that put you at risk of forming kidney stones. But let's stick to diet and lifestyle changes alone. Let's say you've consumed a diet, like I said, high in oxalate. And if you are dehydrated, when you're dehydrated, your urine becomes really concentrated. That can cause these substances to oxidize, not oxidize, but saturate and form kidney stones, which is why one of the most preventative factors of kidneys, preventing kidney stones is maintaining adequate hydration. Drinking a lot of water, following a low salt diet, limiting high intake of red meat, especially, is crucial. If you want to generalize your approach to treating kidney stones, irrespective of the type, we always encourage patients to maintain hydration.
And then I guess I have a question that just came to mind. If someone does have kidney stones, how do they go about getting better? Or what does kidney stones look like in the long term?
Yeah, that's a great question. So kidney stones are more common in men than women. I'm unsure why, but that's just the demographic. Women do get them too. And once you have one kidney stone, the recurrence rate is actually higher, which is interesting too. So that's why it's very important to adhere to a diet. Increasing hydration to at least 3 liters, low salt intake, following a lower oxalate diet. So incorporating more berries, broccoli, different types of vegetables, and protein versus just like spinach, nuts, and red meat. And then if you do have calcium oxalate, calcium phosphate stones, or even in some cases, I'm not sure about uric acid because that's with gout, but specifically with calcium oxalate stones, there's a medication called urocrit or potassium citrate that we can prescribe to patients. Basically, so potassium citrate contains a substance called citrate that binds to oxalate in your gut, and that overall will prevent saturation of oxalate in your kidney and your urine.
Interesting.
So you could also consume food higher in citrate to prevent that too. But that's one medication that we can now prescribe to prevent saturation of these stones.
And then you touched on this a little bit, but maybe there's something that you haven't mentioned yet. But is there anything that people can actually do to prevent them? I know you talked about a specific diet. And is it just kind of something that's maybe bad luck that happens? I know you mentioned some genetic component as well, but
Yeah, like if you have cystinuria, like other genetic conditions, it's tough to get around it. But to the general public, following a lower salt diet and really maintaining hydration is key. If
right.
you're dehydrated, that is usually the number one risk factor for forming a kidney stone. So hydration in this scenario is key. Maintaining at least 3 liters of water intake a day.
Got it. And then let's take a second to kind of bring it back to the labs. So, if someone had kidney stones, is there anything that they could do or they should watch for in their eGFR or their ACR over time?
No, because kidney stones, like I said, having kidney stones doesn't necessarily mean you have kidney disease unless the stone is obstructing your kidney function. If it's large enough, then it's anatomically obstructing a part of your kidney. So the only way to identify it is through a kidney ultrasound and symptoms. Patients present with flank pain. Your kidneys are located that's called the retroperitoneal, meaning they're located in the back, the lower. So like where I'm pointing right here is where your kidneys are. They're located in the back, lower back, in the corners. And if you have pain there and that pain moves toward your groin and there's a burning sensation when you're urinating, those are all signs or concerning signs that you have a stone that's possibly passing. So
Right.
clinical presentation is key, and then identifying a stone on imaging is how you would detect a kidney stone.
And that just to me, thinking out loud right now, as someone I've had UTIs
Yeah,
several times. I think it's one of those things that people are just kind of prone to, but I
right.
haven't had a kidney stone, but they sound like they are definitely similar in some of the symptoms also.
Well, the symptoms of a UTI are very different because you will only have burning pain while you're urinating, sometimes a little bit of blood in your urine, some suprapubic or, lower abdominal pain. With a kidney stone specifically, you could have a UTI as well, especially if there's obstruction of urine, if the stone's large enough. But you typically will have flank pain, so pain where your kidneys are. It doesn't always have to, but it can migrate down your groin. And that's sometimes is when your pain is migrating down your groin, it is usually reflective of the stone possibly moving.
Got it. And then this could be completely inaccurate, but I guess I'm curious for those that do have, let's say, chronic UTIs or UTIs frequently, is that something that can eventually develop into a kidney stone? I know it could develop into some kind of kidney pain or kidney issues, but maybe not a kidney stone.
Yes, that's a really good question. As I had mentioned before, there's 4 to 5 different types of kidney stones. So, we covered calcium oxalate, calcium phosphate, there's uric acid, you can get those stones from having gout. Patients with genetic disorders like cystinuria can have cystine stones. And then if you have frequent UTIs, it can cause a specific type of kidney stone called a struvite stone, which is basically formed when bacteria change the chemical balance of your urine, makes it less acidic, and that encourages clumping of minerals and compounds together. So essentially, bacteria in the urine, specific bacteria in the urine, if you have recurrence of this specific bacterial pathogen causing this UTI, can eventually form struvite stones. It's bacteria that produces ammonia.
Interesting. Before I wrap up with the last question of this episode, is there anything that you want to add or chime in on, something that you haven't been able to really get across during this episode, or anything that you want to let our listeners know?
Yeah, I think, well, we covered a lot. I would say, in general, I think that you should always be mindful during your annual physical, of your creatinine levels, especially and your eGFR, sure. And also your urine analysis. Always ask your physician if there was anything abnormal in your urine analysis, if there's any protein in the dipstick, and then to assess for a spot protein creatinine ratio. I think that's usually crucial because sometimes it could be missed, and then if it's missed, that's usually the most direct way to diagnose kidney disease. If it's missed for months or years, it can cause worsening kidney function. So be mindful during your annual physical examination to get your metabolic panel checked and your urine analysis for protein. And then I would say regarding kidney stones, maintaining hydration is really key.
Absolutely. And then this is likely what you just answered, but if someone is going to go ahead and look at their labs tonight, is there anything else that you didn't mention that you think is really an important thing for them to understand?
No, that's really it. Albumin creatinine ratio or protein creatinine ratio is crucial. There's normal ranges for that as well. Less than 30 is basically normal. 30 to 300, you could have diabetes for maybe 5 or 7 years, you're leaking some protein, but over 300 milligrams is concerning. I would say if it's over 1,000 milligrams, very concerning. And that's when we would consider kidney biopsy. Because when you have protein leakage that's over 1,000, or a nephrotic range over 3,000 milligrams, then there's various, and we can get into this in later topics, but there are multiple autoimmune conditions, infections, and cancers that can cause that degree of kidney damage. And some of them are treatable with chemotherapy. So the faster you diagnose that, the better. Definitely look at the albumin creatinine protein creatinine ratio. If it's over 300, have it looked by a nephrologist. Identify what your baseline creatinine is. That could vary person to person. For you, it might be zero point 0.8. For someone else, it might be 1.1, 1.2. Make sure that number doesn't rise every year. Yeah, that's really it.
No, that's such important and good information. I think that I definitely just learned more in this conversation with you than I have from any lab result that I've ever gotten. Creatinine, ACR, and now kidney stones actually make a lot more sense to me. So thank you so much for really cutting through all of that for myself and for our listeners. And the next episode, we're getting into the 5 stages of CKD and
Okay.
what one actually means and what you should be doing at every stage. So for our listeners, make sure you don't miss that episode. And if this episode helped you understand your own labs, someone you love's labs, make sure you share it with someone who needs it, and make sure you are following and subscribing to the show. And Dr. Gotti, thank you so much for being here and for cutting the noise out of this and really shedding so much light on this for all of our listeners and myself as well.
Yeah.
And it's a pleasure talking to you, and we'll see you soon.
Yeah. See you soon. Such a pleasure.